Dr. Avinash.
Yes, Dr. Amburajan. I won't be able to rather continue. I may not be audible. I am traveling by road. So you can begin. Yeah.
Okay, sir. Right. So, good evening to all. We welcome you all on behalf of IMA College of General Practitioners for this series of lectures by Synapse, Brain and Spine Foundation. So, a series of lectures were being given by Dr. Jayadev, who is a eminent neurosurgeon. Really, these lectures were very much liked by people who have been attended. That was indicated by the interactions they had with him after the lectures. So those who are attending this series of lectures are blessed, and the learnings were very good, and all the pictures he is showing was very excellent and typical, and also the way he is explaining coming to the level of general practitioners is being very much appreciated. So we have completed low back pain and disc prolapse, sciatica and neurogenic claudication, neck pain and cervical spondylosis, winging disease, eye twitching, hemifacial spasm, trigeminal neuralgia and severe facial pain, and signs and symptoms of brain tumor. Today, we are going to hear about hypertension and brain. What a family physician should know regarding this, that we are going to hear today. So I welcome you all for this wonderful evening session. And we are left with only one more session on 1st July. Now I request our Dean, Avinash Pandey, to give his opening remarks. Dr. Avinash.
So today's lecture is on hemifacial spasms, huh? Not hypertension.
Yeah. Thank you, Dr. Amburajan, and thank you, Dr. Jayadev Panchawat. This is a very interesting topic we have mentioned, and till now we are rather in the fifth lecture, and we are getting very good reviews and good feedback from all our members, and this is definitely going to be very important thing. I would like to inform everybody that all these lectures will be made available on the YouTube site of IMA CGP, and definitely you can review them again and again. And of course, if there are any problems, I'm sure that Dr. Jayadev Panchawat will definitely rather answer those on your email. Dr. Jayadev Panchawat, as you know, is a prolific speaker and a well-known neurosurgeon in Pune. Not only from Pune, but not only in Pune. He has got international fame, and with all due respect to him, we have been rather continuing this lecture series, and I think there are 2 more lectures, and we'll definitely enjoy this. I request Dr. Jayadev Panchawat, sir, to continue his speech. Thank you.
Sir, excuse me, sir, for interfering. Dr. Jayadev,
yes.
There is one question in the question box that related to yesterday's, last week, this trigeminal neuralgia.
Yes.
Want to give the reply now or after finishing this lecture?
You can ask now.
Sir, it's is there any relationship between exposure to extreme cold weather and trigeminal neuralgia?
There is no direct relationship, but exposure to extreme cold can start an attack of trigeminal neuralgia, but it is not a causative agent of trigeminal neuralgia.
Okay, thank you, sir. For the benefit of all the attendees, kindly fix your, put your name, your email ID and WhatsApp number, and your concerned medical council number in the chat box. And any questions you are having, even during the lecture, you can put it in the question and answer box, so that you will be getting proper answer at the end of this session. Now, Dr. Jaydev.
So I am sharing this screen now. So today I will be speaking about a very interesting topic which is known as hemifacial spasms. And this topic is really misunderstood in not only amongst general practitioners, but even, you will be surprised, even amongst physicians and neurologists. It is not understood properly, and very few people are aware that it can be cured. As it is causatively similar to trigeminal neuralgia, I have taken this topic in succession to trigeminal neuralgia. And in the last 15 years, we have done more than 300 cases. This particular series is about 2 years old, I think, and 220 patient series, which we had presented in Mumbai in the International Conference of Neurosurgery. And I will be showing you the important features of this disorder. And then you will realize that you have actually seen many of such patients actually, and they have not been diagnosed properly. Many of these people go to neurologists thinking that they have facial paralysis, and actually what they have are the spasms, as I will show you. So what are hemifacial spasms? As you can see here, hemifacial spasms start with twitching of one eye. Okay, there is repeated spasms and twitching of one eye. And I have repeatedly written about it in Marathi and also in English in local papers, so that people understand what this problem is. So it looks as if this person is winking, and then after some months or years, these spasms spread to the cheek, and then they spread to the angle of mouth. And after that, there is almost a continuous series of contractions. When a person starts speaking, you will see series of contractions like this. He tries to relax his face, again the face contracts. As the days, months and years go by, these spasms become very severe. And then someone diagnoses it, and again people are not informed properly about the options of treatment and which treatment can cure it permanently. And these spasms, mind you, are not only cosmetic. When one starts getting these spasms, they are not able to drive, they are not able to read books or watch television or work on the computer. And many a times there are absolutely ridiculous kind of, absolutely ridiculous kind of misconceptions, because people think that these people are winking continuously or making grotesque actually faces. So you can see this very severe spasm, continuous winking, grotesque face, etc. And that is why this disease is so important. And some of these patients, they are so depressed that they shut themselves inside their house. They refuse to go outside. Someone tells them to take Botox. Botox only relieves temporarily. Again, it starts. And when it starts more severely, because the compression, like in trigeminal neuralgia, it is the vascular compression. But this time, this compression is on the facial nerve. This hammering is on the facial nerve. And that is why these people get these spasms. As I had told you last time, the blood vessels, even in this case, go on increasing in length and they become tortuous, and the severity of the disease goes on increasing. Repeated injections of Botox can actually cause permanent paralysis of some of the muscles. Botox can cause botulinum syndrome. Botox can cause anaphylactic reactions. And more importantly, it is a very short-lived kind of treatment. What Botox does, it is paralyzes the muscles. Whereas the actual reason for these spasms is inside, within the brain. So paralyzing the muscles is just a superficial remedy. And the problem which is brewing inside is actually increasing over the period of time. And as the problem increases, it becomes more and more difficult to treat it afterwards. So last time I had shown you this video. This is a representative video of a blood vessel which is hitting on a nerve. And the same thing happens here like trigeminal neuralgia, but this time this nerve is actually a facial nerve. So imagine that this is a facial nerve and this is a continuous pressure, that is pulsatile pressure, that causes these spasms. Now initially the blood vessel curve is not very severe, and as you can see here, this person has got minor spasms relatively, only twitching around the eye. You see, now this is a moderate spasm because the blood vessel has further increased in length, and this is a severe spasm because after some more months or years, the blood vessel further increases in the length. So these are the stages in which these spasms progress. Now I will show you some examples so that you will see the variety that is seen in these patients who have hemifacial spasms. Now this lady came from Varanasi, had spasms, and this is after microvascular decompression surgery. Now she is able to speak properly. This guy also had severe spasm in the left eye, and this is a post-operative video after a month where the spasms have totally gone. And these spasms usually go permanently. So 99% cure rate is there if the surgery is done in a proper way. Now this is again after surgery. You will see another gentleman with spasms here around the eye and in the cheek, and this is few days after surgery. His spasms are totally gone. Again, very severe spasms while speaking, very grotesque movements of the facial muscles. And this is after 3 years after surgery actually. And this guy who had come from Dubai had very severe spasms. This is on the 4th day after surgery. The spasms are gone. Now this lady, again very severe spasms. And this is the interview taken a few months after surgery. Complete disappearance of the spasms, and it gives the confidence back to these people to go back in the society. And it is a permanent kind of result. See these spasms which are near the eye, and this is after surgery, few months when they come for follow-up. And again, relatively minor spasms around the eye, but very embarrassing. And this is again maybe 3 years after surgery. This guy also came from Philippines, and you see this spasm. This is after surgery, complete disappearance of spasms. And these spasms, as I told you, start near the eye, the eyelid, and then go down to involve the face. This lady had right-sided spasms while she is a teacher. And this is after surgery when she had come for follow-up. The same video of this person who had come with severe spasms. This is again 3-4 years after surgery. This lady had left-sided spasms, and this is 12 years after surgery. When she had come for follow-up, we requested her to give this lady who had come from Delhi for surgery, and this is after surgery. So these are different kinds of examples of spasms. Usually they are difficult to miss, and only thing is that you should know what this is. People come with some grotesque movements, and they either initially go to ophthalmologists or general physicians, or they can go to general practitioners. So early diagnosis is important. Now this lady, again after surgery, very confident face. You can see the spasms almost like winking, you know. And again, few years after surgery, this is the interview. Again, this lady who is a police officer, and you can imagine that it will be impossible for her to work in the field as a police officer. And you can see a very happy woman here, police officer, with complete disappearance of the spasms. So, in short, one has to remember that hemifacial spasms can be really embarrassing for people. They are not just some movements which one can neglect or just give Botox for some time and ask them to bear with it. They are really suffering in their life. They are psychologically very in bad situation. They are not able to continue with their job or with their family life or with their social life. They cannot mix up easily in the society. And all these people are testimony. This is not at all the entire series, but just to give you an example, I have included some patients here who spasms. Now this guy again, a hotel owner, and with spasms. Now if he's sitting in a hotel and speaking to the customers like this, you can imagine what the customers will think about him. And this is after surgery, a very confident face here, and he is now able to continue with his job. So these were the few examples. And last time I told you that trigeminal neuralgia surgery was done in 1960s, and so was hemifacial spasm surgery. And Peter Janetta was again the person who did this surgery. And from then on, there have been a lot of improvements. Again, to the best of my knowledge, there is one center for hemifacial spasm surgery in Pittsburgh. There is one center in Japan and one center in Pune in India. So this is a very niche work, and very many people whom I showed you, they have come from all the parts of India, from South India, North India. They have come from Bangalore, they have come from Delhi. Some of them have come really after, consulting in AIMS in Delhi. Some people have come from Kerala, some people have come from Punjab. So, we get patients from all over India, because this surgery, as I told you, is a very deep-seated surgery done near the brainstem, and it requires specialized kind of team with nerve monitoring and different kinds of gadgets. So Janetta was a person again who performed this surgery in 1960s, and the nerve, how it gets compressed by different combinations of veins and arteries. That's what we have studied over the period of last 15 to 17 years. And the long-term results, this actually presentation is a bit old. It is 2 years old. So these are the 220 MVD surgery results, and were done between 2008 and 2020 March. 220 patients operated by a single team, and these are the results. And how we studied the results, we studied their files, and they were telephonically contacted or actually called for follow-up. And we have 99% success rate here. Now again, all of them had MRI sequences to show the facial nerve. As you can see, this is the facial nerve, and the black thing is a blood vessel, this curving blood vessel, which is pressing on the facial nerve and was causing the... So all of them were studied before surgery with CISS sequences of the MRI, and then a definite diagnosis was made, and then they were counseled, and with their permission, surgery was performed. This disease is known to be more common in females, and the same thing was found in our series, females more than males. The age, mean age, the commonest age was around 50 years of age at the time when they came for surgery. So the age, the severity increases as the age advances because blood vessel goes on elongating and becoming tortuous. And from 40 years to 60 years is the common age for this disease. But we have had patients from 21 to 72 years. Last month, I operated on a patient who is 78 years old. Very severe spasms, not able to lead normal, meaningful life. Now, side affected right side was more common than left. And in clinical features, why they came for surgery and what was bothering them. So everyone obviously had social embarrassment and handicap in social or occupational progress. 146 out of 220 had difficulty in reading, driving, and daily activities. Some people also had clicks in the ear along with the spasms. That is because the vestibulocochlear nerve runs along with the facial nerve. So the same vessel compresses both the nerves. Some people, along with the spasms, had tinnitus. Some people had facial weakness. Some people had facial pain following spasms because of continuous contractions. Some people had, coexistent trigeminal neuralgia or glossopharyngeal neuralgia. And some people came with clinical depression along with spasms. And the depression was because of the spasms and because they were not told that they can be cured. They thought that for life their face will be like that. It will go on increasing. They will never be able to go into society. Their job will get hampered. They will not be able to, marry or form friendships. So they had really resigned to their fate. They were not told about this specific option to cure. And insomnia was another clinical feature. Surprisingly, 19 people, they said we cannot go to sleep. As soon as we sleep, the spasms start and we are woken up. Last time I told you that trigeminal neuralgia, because of the pain, was called and it's still called as a suicide disease. But even in this disorder, there were few patients who told me that they have contemplated suicide because of the severe hemifacial spasm. So suicidal ideation was admitted by 3 patients out of 220. So this is a general information about the reason why these patients are handicapped because of the spasms. So in outcome, 99% had absolutely excellent outcome. Relatively very few side effects, but any surgery can have potential side effects. As you go on, operating more and more of these patients, because this is a rather specialized surgery, as you go on operating on more and more of these patients, can you see the screen now?
Yes, sir, we can see it. We are seeing the screen, sir.
Can you see the screen?
Yes, sir. Yes, sir. We are able to see it.
There's some problem in transmission.
Okay. But it is not moving, it's still.
Can you hear me properly or it has changed?
We can hear you properly. We are able to hear. Now there is no slide, sir.
So this is a example from one of the videos. You can see a facial nerve here, and this was a blood vessel which was compressing, and the decompression was done. So this is the picture that we made after surgery. Is there a problem in streaming?
No, sir. Your voice is clear. Your screen is visible, sir.
Can you hear me?
Yes. We can also see your screen.
Can you hear me?
Yes, we can hear you.
Able to hear you, sir, but the slide we are not seeing. You are very much audible, but slides we are not able to see, sir.
Can you hear me?
Yes, yes.
There is some problem in the. Okay, I will continue now because. Shall I continue?
Yes, yes, sir.
So okay, so this is the. Basically, it automatically changed. The speaker automatically got changed. I don't know how. Anyway, so this is the facial nerve, and this is the.
Sir, please share your screen, sir.
Okay. See it now? So, okay, so this is the blood vessel and this is the nerve here and the compression. And these are again few videos of the patients with hemifacial spasm after surgery. Again, I showed you some of these videos, so I'll skip this slide. And in the last, 14, 15, sorry, years, we have had the chance to study these conflicts and actually draw wherever different types of conflicts were seen, and we have divided these problems in different groups. It helps in the treatment. So this was to just make you aware about the problem and the fact that it can be cured, and the fact that these people have to be informed about this possibility right at the time of the diagnosis. So I think I'll stop here. If you have any questions, I will answer them. This problem is persisting, maybe on my side, I don't know. There is a electricity going and coming, so I think it is changing the modes or something like that. The backup is not working. Can you hear me now?
Sir, we are hearing you, sir.
Yeah, so basically,
we are getting some difficulty in opening the things, sir.
So if you have any questions, we can take it now or maybe next time, because it started raining here maybe, and that is because of that the electricity is fluctuating and the network is fluctuating because of that.
There is no questions in the question box, sir.
All right, so we will just stop here. Next time when we speak, maybe if there are questions, we'll take them.
Okay, that's fine, sir.
Unexpected rains, I think they're disturbing this network that is causing the problem. Okay.
Yes, sir.
All right.
Anybody having, sir, what is the probable cause of this surgery? That is one question.
Doctor has left, I think.
Doctor has gone on.
Yes, he has left.
Okay. So to all those who attended today's, this series of lecture. So today is a very, important topic, that hemifacial spasm, which is not only a, we can say it's a social problem also. And most of the time, the person who are getting it, they get into a lot of psychological problem. So socio-psychological problem they are getting, and then it hinders with the progress of the patient, and also even somebody will have suicidal tendency, a wrong conception of about the person, and they were not able to continue their profession. So many hurdles they will be getting. So very clearly it was explained today, and really very we have to appreciate Dr. Jaydev, this, because it is one of the few centers where this kind of surgeries they are doing. So this today it's a very big exposure to all the general practitioners who have attended today, and really we are very thankful to Dr. Jaydev, and also to Synapse Brain and Spine Foundation, and we thank our Dean Avinash Bande sir for getting this kind of group for our CGP programs. Then I also thank all the joint secretaries and our secretary of IMA CGP. And let us close today's session. Bora Satyajit Bora sir also here. Thank you, sir. And let us all close this session today. And if anybody having any questions, that will be answered in the next week session. Okay. Thank you very much for all. The questions today will be answered in the next week session.